Hi everyone, Nurse Phill here, host of Community Builders Show. Welcome to another great episode. We have a fantastic guest to introduce to you today. I hope you've all had a good week and everyone is feeling well. So today we're very privileged to have Lauren Sing come on and talk about what she does. I don't want to spoil it. I'll let her do that and get to introduce her and show you another way you can help improve your client's capacity and actually get them functioning a lot better. So big warm welcome to Lauren. Say g'day, Lauren. How are you?
Hi everyone, I'm good, thank you. I hope you're all well as well.
No, it's good. Now, Lauren, I didn't tell them what you did. I wanted to be a surprise. Could you tell us what you do? What's your role?
Absolutely. So I'm an exercise physiologist, and last year I started my own business. I wanted to make a mixture between mobile services and private practice. So I have a private practice out at Manly, which I work 1 day a week, and I do mobile services as well for the rest of the days.
Well done. So we have a lot of support workers and other people in NDIS here. So what is an exercise physiologist?
Absolutely. An exercise physiologist is an allied health professional who has done a minimum of 4 years at university. We are trained in treating chronic health conditions through exercise is movement and treatment forms in that way. We do a bit of rehab as well. And we work as a multidisciplinary team with other allied health professionals. So we are well equipped with knowledge based on all the contraindications and everything that someone can do with exercise in relation to their health condition.
Oh, right. So what's an example of a common health condition that you help with exercise physiology?
Yeah, so a common one we treat is diabetes. We also treat a bit of oncology. We do a lot of disability as well, which is the system that I like to work in. I have a bit of a passion for amputees as well. I like to work with everyone. So yeah, common conditions like that. You also have neurological conditions that we also treat, a bit of everything from respiratory and everything else as well.
As well. So neurological, is that like people with like MS or MMD, that sort of neurological, or is it like a stroke sort of thing?
Bit of everything. Yes, you're absolutely correct. So all the way from stroke through to Parkinson's disease, absolutely all of that is encompassed in that bracket.
Ah, have you got Alan Border's number? I heard he's got Parkinson's, so he needs a bit of
Oh, I don't.
exercise. Yes, he'll need to get himself sorted so he can yeah, keep him well longer, which is brilliant. That's brilliant. So your mobile services, does that mean you go out to people's homes?
Yes, it does. And I also do hydrotherapy as well. So I travel out to pools and stuff like that too. Go to homes. I've been to like housing for mental health as well, done all that sort of stuff. Nursing homes, you can do that too if you
Yeah.
need to get someone of older population. Yeah.
With taking, because I know a lot of support workers, they take a lot of their clients to hydrotherapy and things like
Mm.
that. Is there any good tips you have, like of how to manage their clients with hydrotherapy and getting them there and how to prepare them well for a good session?
Yeah, absolutely. So it does go on an individual basis. However, if a client has got something where they like to listen to music, for example, to get them in the right mind frame to exercise, whether they want to watch a video or even just talk to them motivationally with positive reinforcements about the exercise, if they're not too sure on it, just get them in a really good mindset would be a way I'd go about it.
Yes.
Are on the way there.
And
Absolutely.
then does that help get the client more engaged with the exercise session?
It does sometimes, yeah, a client basis thing, but absolutely. And then that's where we come in as well. So exercise physiologists are trained in motivation and behavioural therapies as well. So we do
Okay.
understand how to also work with psychological aspects to incorporate the exercise around how someone is behaving.
Oh, so as an exercise physiologist, you can actually make it like fun for them and engaging so they can want to do the exercises.
Absolutely. I believe in fun. I believe in fun and effective. So that definitely helps out with getting people to exercise a bit more and keep everything in line and get the best for the client at the end of the day.
Yeah. Oh, that's brilliant. What have you ever had a client that you've had a challenge with trying to motivate?
Yes, I've had a lot of them. I have got there in the end. So it's about building trust with the client. Step number one, getting
Yep.
to know them as a person as well, because at the end of the day, they're not their disability. They are who they are. So you want to get to know them on a bit of a personal level, like what they like and what they dislike. So you don't want to give them something they don't like.
Yep.
And with regards to all that, once you get their trust, you can bring out the confidence in the client. And you could do rewards depending on the age category. For instance, if you've got a kid, you could do games time every 5 minutes for 30 seconds.
Yeah,
For an
right.
adult, you could do, if they just want to relax in the pool, they can go and relax in the pool.
As long as they've done the hard work first.
Absolutely, yes.
That is a big one. That is a big one. When you're doing the exercise for people at home, how many times a day would you go see them to do their exercises?
I only see them, a lot of them, once a week. So I give
Okay.
exercise programs. This is where support workers can come in and help me out, because not everyone has the budgeting to see me twice a week. So
Yeah.
I can hand a program via PhysiTrack, which will also have PDF, where the support worker can help the client guide through the exercise program, and that means they get more benefit because they're doing it more than once a week. So yeah.
So what's PhysiTrack?
So PhysiTrack is an app. It has the video, which is really helpful. It has a bit of text describing the exercise, and it also has the video of how to do it. So I have the luxury of being able to make the video to suit how I want to do as well, if they don't
Yeah.
have a set model. And I can send the PDF copy with pictures as well with the text, if that's better.
Oh, that's good. So the support worker can read it, understand how to do the exercise, and show the client.
Absolutely. Yeah, anyone can use PhysiTrack. Yeah.
Because I do see that a lot when I go in and do nursing assessments and things,
Mm.
and the support worker, like, got the exercise physiologist there, and they're doing the exercises, and the support worker's hiding in the corner or under a couch, going, "I don't want to do this," but it's really important, isn't it, that they actually have the opposite way of going, "Oh, actually ask questions of you and go, how can I actually help my client with these exercises?" And watch you do it.
Yeah, absolutely. And so if there's something they're not sure on, you can just skip that exercise and then I can modify it the next time I see the client. So if you're not sure, better off not
Yes.
to do it. And then have a chat to
Okay.
me. I'm more than happy to answer the phone, more than happy to send an email, and then we can clarify that exercise for the support worker as well
'Cause
and the
I was
client as well, of
I was
course.
going to ask about that. What happens, sometimes like if your client's really stiff and can't do that exercise that day, so you just advise just bypass that one and go on to the next exercise.
Yeah, so I also do give out stretching programs. So if during my initial assessment, because what I do with my process is we go through initial assessment first, whether
Yeah.
that be at the client's house, whether that be at the pool, because I quite often get in the pool with people as well for hydrotherapy.
Oh, brilliant.
Um, yeah, it's great. It definitely helps motivate too, as we were talking about earlier with motivation.
Yes.
Yeah, and so what I do the initial assessment, I find where they're stiff and all that as well. Quite often I will do a bit of stretching in the program as well to loosen up first, just through dynamic movement, so just moving, and then into the exercise stuff. And yeah, it depends on how they're feeling on the day. We might just skip something, we might change it. It's always a changing environment when it comes to exercise, because everyone wakes up in different moods and everything as well.
That's true. The moods are very true. Very true.
Yeah.
So what are some of the benefits of actually having exercise physiology for anybody?
Absolutely. So I'll go through a bit of an overview of the areas that we do cover. So we go through, as I
Yeah.
mentioned, the neurological, we do the respiratory, we do the cardiovascular. We also go through musculoskeletal is a massive one for us. A big one for us is actually, just to narrow that down, lower back pain, a really big area for us as well. We do endocrine issues. We pretty much do everything that
Yeah.
you can
Wow.
imagine.
Yeah.
And so once we go through that process, there's obviously some exercises that people straight out are not allowed to do, because we have exercise-based guidelines that we follow, all through research and all that. So it's safe for the client. So that's called a contraindication. There's also a relative contraindication. So we also are aware of those. But from that, we rule those out first, and then we go through exercises that the client enjoys, first of all, but is
Yeah.
targeting their goals. Because I'm a big believer in goals, and we set goals at the start.
Yeah.
We do, yeah, short, mid, and long term. So they're achievable goals, which is also really positive for the client when they achieve their goals. And it definitely assists in getting progress out of the client.
Oh, that's brilliant. That's brilliant. So
Yeah.
you can see a progression and of the exercises and what people are doing and improving.
Absolutely. And it's really rewarding to see that as well, because the clients are so happy to achieve that. And you see the smiles on their faces, which is so wonderful for me, knowing they've worked so hard.
Yes. Oh, that will. Have you got a good client success story that you've had recently?
Yes, I do. So I've been working with a teenage boy. He is 15 and he had an excessively rounded posture, as a lot do these days, from
Oh,
sitting down.
yes.
And so we've been working with him over a few months on his posture, getting him up tall, getting him stronger as well, because he's quite underdeveloped in muscle tone.
Oh,
So, yeah, so obviously really important as a developing teenager that they need to be gaining some muscle for life function and organs as well. So he has now improved his posture by half, I would say, in being able to stand
oh,
up, half of the height he could before. And it's reduced his lordosis, so the massive curve in his lumbar spine. And
yes.
yeah, he's doing a lot better. He's got more energy as well because exercise produces endorphins. And so it's been really successful in getting him upright.
Oh,
Yeah,
brilliant. Yeah.
absolutely.
And what was that? What was the cause? Why was he unable to get upright?
His is a case of bad posture, but he also has got
Really?
ADHD as well. So he would have the tendency to be on the computer devices because that's what he liked doing, but it's
Mm,
caused him to round, unfortunately. So it's helped his ADHD in the long run as well. His energy levels are a lot better. He used to fall asleep in the car on the way home, and his mum
yes.
is telling me he can now stay awake. So we've seen a lot of success in regards to his vital function as well as his posture.
Very good. And
Yeah.
because one of the big things I'm seeing a lot these days is because like the teenagers and kids aren't getting around as much, they don't have the bone density anymore. It's like because they're not creating that impact to grow their bones. So how do you manage that sort of scenario?
Yeah. So with bone mineral density, a lot of bone loading is ideal for those sort of clients. So you're
Yeah.
looking at your jumping movements, so you can make them fun. So I get the evidence-based guidelines and I see what I can do within them and I make it a fun movement. So whether I add in some ball throwing or whether I've been doing juggling with some of my clients because they want to learn how to juggle. Really great for brain training at the same time.
Yeah, yeah.
Yeah, so you're sort of
Can you
adding that fun.
juggle?
Not, unfortunately, I can't. I'm trying to. I'm training.
Yeah,
Yeah,
it's tough. It's tough. Yeah.
very, very tough. And I'm training because I want to be able to do it so my clients can do it and I can lead by example. So,
Yep.
yeah, so absolutely, I would call. Yeah, so you
No,
want to
that's
load that.
yeah. Oh, that's brilliant. That's brilliant. So, how can like support workers and carers assist their clients through exercise interventions?
Yes, absolutely. So as I was talking about earlier, that program that I would send through, it would
Yeah.
have it all on there. So all they have to do is follow that program. And as I said before, leave it out if you're not sure. I'd rather leave it out than have it done wrong. So,
Yeah. Yeah.
and you can still get a good amount done. A typical program for most people, you're looking at least 5 to 8 exercises. So, as you can see, if you leave one out once, it's not going to be a big deal at the end of the day.
Yeah.
Yeah, exactly. So that's how they can really assist me, is because ideally I like people to do 2 to 3 times a week for exercise. And support workers are with the client so much more than I am. So if I see them once a week for 45 minutes or an hour, they can then increase, for example, their bone mineral density a lot quicker by doing 2 to 3 times a week. And that's where support
Yes.
workers can really help me, because that client is getting all their program in. It's also a bit of brain memory as well, muscle memory for that client. It's really good for the support worker to experience new things and learn how to do additional skills as well.
Well, they can probably tag along and help them because I
Yeah.
know support work is very demanding work.
Mm,
Very labor intensive. So the stronger you are and more flexible, less chance of injury, isn't it? So it's
it
really
is.
good.
Yeah,
It's really good.
it's really good because you want to be in, preventing injury. Really important aspect of our job as well.
Yeah, and keep it going. What do you do if a patient's having issues with their exercises?
Yeah, that's where I come in. I modify. So this can come down to things like, it can come down to not liking it as well. It could come down to a movement restriction that then it's okay for them to do, but they're just not comfortable to do it at the end of the day. So when it comes into this situation, I modify the exercise. It could just be a simple thing of 3 centimeters. It could also be changing it completely. Depending on what the client needs, that's what I go by.
Okay.
Just
Yeah,
check
right.
the moment. Yeah.
So if let's take stretching for example, and like
Yes.
they don't have limited stretching, like, and it's not comfortable to stretch all the time. You try stretching it, even trying to touch your toes,
Yeah,
but it is necessary to do, even though it is uncomfortable. It is necessary, isn't it,
it
to
is
push
necessary to
yourself a
stretch.
bit? So how do you get that balance between knowing that you're stretching like at a good distance and pushing yourself enough to going too far?
It's a really great question. So the way I go about stretching is to the point of discomfort, but not pain. So
Yeah,
if you're
right.
in discomfort, you can slightly feel it stretching, then that's doing what it's meant to do. But if you're feeling excessive pain or something like 7 out of 10, an absolute stopping moment there, we don't want
Yes.
to be feeling that, because you could be damaging some muscle fibers there, and we don't want to do that.
Yeah.
But you can just gradually, and how stretching works is we gradually improve that over time. So we start at a point. We can also do it through dynamic movement. There's different ways of stretching. So we can go through a functional stretch, or we could also just go through a static stretch where they're sitting still, for example.
Oh, okay. And just go till they feel like a bit of discomfort and then stop. So how would a support worker, because like if you're there once a week and they're going to try and do it like a couple more times, 2 or 3 times more in that week, how would they know when to help the client to start and stop?
Absolutely. So this is where it comes down to everyone knows their own body best.
Yeah.
So definitely, and I'm the same. I communicate with my patients a lot about stretching. I'm saying, because it's 20 to 30 seconds, 1 to 2 on each side. I'm just saying, how are you feeling? If they're saying, oh, it's a bit tight, but it's okay, I'm happy to keep going. But if they're going to tell me I'm in pain, we're going to stop that stretch there.
Okay.
It's definitely all about communication, as is a lot of things with exercise physiology, all about communication with the participant, because they know themselves best. Because you can't feel what they're feeling, but they can tell you what they're feeling.
They can
So,
tell you and go, yeah. No, that's
yeah.
brilliant. That's brilliant. That's because flexibility is one of the big things that we need, to keep mobile and reduce muscle injuries and keep you in good posture, good shape, isn't it?
It is, and that's why through a lot of my programs as well, I do a lot of dynamic movements, because that in that form increases the stretch multiple times throughout the session. So it's important to you warm up. You've got to get the body warm, and then you've got your session stage, and then you cool down. So I definitely add a bit into everything, depending on what the person is. I will, what their condition is, I will add depending and appropriately for that intervention, because you want to be optimal for them. At the end of the day, it's all about them.
Yes. And what can you just said dynamic stretches? What is a dynamic stretch? What does that mean?
So it's where you're moving while stretching. So for example, that could be putting your hands across your chest, and I'll try and demo in my very tiny space. I
Hey.
have a bottle here. All right. So you can put your arms across your shoulders, and you can just move around this way.
Oh, okay.
So
That's so
yeah,
it's moving, it's not staying still, it's moving while you're doing it.
yeah, and so it increases your range of motion as well over time. You won't be able to improve that in one session. So over the course of a year, I see significant improvements in a lot of clients in how they go about their rotation in that stretch, for example, not to mention many others, because we target that muscle group in all different parts of the session, not just one, but multiple.
No, that's good. I like that. I was just thinking what you were just mentioning, talking about motivation there. How, like, how, and with exercise physiology, we've got to do it for long term, isn't it? It's not like you're going to do a 2 or 3 week program. Oh, I'm all good. I'm like Arnold Schwarzenegger, woohoo. It is a long term thing. what can we do to help keep our clients motivated for that long period of time?
So what I find over time is that once someone gets to enjoy exercise a bit more and they see the results are coming, they want to keep doing it themselves. So therefore, that's one form of our motivation, is they have self-motivation. So that's one of our definite goals, is to get self-motivation out of a client.
Yeah.
It's definitely, and quite often, in some cases, a family member can be really supportive for that client as well. I found with certain conditions, for example, if you have someone with dementia, really hard one to treat, but if they have someone they know and they're really comfortable with, they're really happy most of the time to go along with everything.
Oh, right. Yeah.
Yeah, so it's just having that, in that case, comfortable environment. But yeah, motivation over time. Honestly, once people see results, they're really happy to continue.
They keep going and keep
Yeah,
pushing forward because, yeah, because I've got a couple of clients that they do have a few ways to get out of it. Is that a nice way of putting it? And
it is
it's
an.
like, and it's like, if you actually stuck at it, you would feel so much better. But it's like this barrier, and it's like, oh no, I'll use this excuse today to get out of it. And you're like, well, that's one day less that you're going to have to feel good, So do you have any help for that sort of situation?
Yes, so long term, I would definitely recommend explaining the benefits to them. If someone knows why they're doing something, it can lead to them wanting to do it more. It
That's a
won't
good. Mm,
everyone. Yeah,
yeah. No, I like that. That's really positive because it is all about why you're doing it, isn't it?
correct. Yeah. So, like, if you think about yourself, for example, if you know why you're doing something, then you're going to be more inclined to be like, oh, I'm going to achieve this at the end.
Yes, very true. Very true
Yeah.
indeed. So that's brilliant. That's brilliant. Is there any other areas of exercise physiology that we haven't covered that you think, oh, the listeners and the viewers would love to know this?
Yeah, absolutely. I'll just get up on my computer. So, the other interesting one as well, I guess, when it comes down to it, at the end of the day, a lot of people don't realize that exercise helps a lot of conditions.
Mm,
So, with regards to mode of exercise, when it comes down to everything, it's going to be about education. And a lot of
yes.
our role is education. So, upon educating clients and also support workers, and in some cases their families, because their families won't understand why they need to do it. If you can talk a family around, then potentially your client will do it too, if they listen to their family more than someone else.
Because they
Um,
get that moral support.
absolutely. Moral support, it comes down to all that.
Very
Just
good.
a minute up. So just. Okay. Where'd it go? I had the document up and I had to shut the laptop down. So, there
Ah,
we go. Perfect. It is opening very, very slowly.
I know that feeling.
Yeah, it's one of those chronic pain. That's the other one I wanted to discuss. So we
Oh,
do
yes.
metabolic health conditions, we do mental health, but chronic pain is a massive area of ours. So with chronic pain, most of the time we get them in the hydro pill first, just because it reduces the pain symptoms. It takes that body weight away, which makes it easier for that person to move. A really big aspect, a lot of people don't realize that we actually treat chronic pain. And I have a big passion in this area because if you can reduce someone's pain, you improve their quality of life.
Oh,
And
definitely. And less
yeah,
drugs.
less drugs, absolutely. I'm all
Yeah.
for that because it has been shown, for example, in cases with type 2 diabetes that have been some get put on insulin in type 2 diabetes. Some people also don't know that
Mm.
you may be able to get off that insulin if you can get
Yes.
the levels right. And so by exercising, it can do that. Through exercise and diet, it's a wonderful combination. So I work quite closely with dietitians, also physios, because they do more hands-on things like diagnosis and massage, where we're more hands-off.
Yeah.
Um,
Yeah.
yeah, so that would be the other thing.
And see, with type 2 diabetes, that's a really good one because people think, I get this a lot, especially working in emergency, and people go, oh, I've got rid of my diabetes. It's gone now because I'm on diet. It's like, no, you're
Mm.
doing a great job to actually get it down to diet and exercise as being the thing that controls your diabetes, and you don't need the medications. There's because they're like, oh, I'm cured, I'm fixed, it's like, no.
Yeah.
So we call them diet controlled, and it's all about diet and exercise. And even with diabetes, like people that have high blood sugars or really low blood sugars, there is a lot of it around exercise because of what exercise does for your cells in your body and the way it
Mm.
uses the glucose, um, can change the effect of diabetes. So it's
Yeah.
definitely a big winner, keeping
Yep.
people motivated and activated. How do you keep people's like heart rates going and things like that when they're immobilized? So people that don't have a lot of function, like of their legs or arms, or
Yeah.
how do you try and get their heart rate up to a good cardiovascular level?
The exercise in this area is actually really cool. So because if you look at for example, someone who is a quadriplegic and they're in a wheelchair,
Yeah.
you can get a simple device from Kmart. It's called a floor cycle, or you can have the proper machines. The proper machine is called an arm ergo machine, and what it does is it works the cardiovascular system because you're moving your arms like you're cycling, but you're still getting the same effects as the legs. So
Ah.
yes, really positive impacts on the heart rate. Also, medications can impact heart rate on whether it increases or decreases as well. So that's why we need to know medication, just so we're aware of the natural level that would normally increase versus what is someone on medication for. So you can absolutely do that. And if someone can't move their arms with the floor cycle, you can put it on the floor.
Yeah.
And so you don't have to get them up. You can sit in the same chair and they're just cycling over, which
Oh,
is really great.
yeah. So that keeps the movement and gets the
Yeah.
blood pumping and gets the heart going.
Yeah.
Brilliant. That is excellent. So that's really cool. And
This is
that and you would set up a program and then for the client, and so they can have it like several times a week and get their cardiovascular exercise in.
Yeah, exactly. And even things like airboxing. There's so many ways we can go about it. We're aware of them all. And if we're not, we go and research it and learn more as well. So we learn further education every year. We have our professional development points. So we learn
Yes.
more. And all the up-to-date research we review every year as well. So everything comes out at different times, which is pretty cool. So try all that when it comes out.
That is brilliant. That is brilliant. Well, thank you for your time today, Lauren. Um, it's been really informative, and seriously, exercise is one of the best things that we can get people to do, and even ourselves, really. We should all be exercising and keeping ourselves mobile as possible. And the earlier you start, the better you are, it lasts longer. So it, I can't stress it enough, especially when you see people and they get really sick. The ones that have really good exercise before they got sick normally bounce back and recover a lot quicker. So it is, isn't it? Like
Yes.
it's the vital thing. It's like the what do they call it? The pyramid. So you got eating, mental health, exercise, and sleep. So it's one of the big four. So
It is.
vitally important to do. Vitally important. Well, thank you for your time, Lauren. We really appreciate you being on the Community Builders Show. A lot of great information for all you support workers out there and other people in NDIS, and have a think about what you can do to help your client. And if they've got an exercise program and you've got an exercise physiologist like Lauren, hit them up. Look, Lauren loves questions, don't you, Lauren?
I do. And I also treat people of all ages. I treat children from the age of like 2 all the way through to elderly. So more than happy to help.
Everybody, everyone. So yeah, and you can really support your clients and help them get more exercise tolerance and feeling a lot better about themselves. Like Lauren said, they release a lot of good happy hormones to make you feel good during the day. So wonderful, Lauren. Where can people find you?
So I have a website. I can send all my details to Nurse Phill and he can share all that with you.
Lovely.
And I also have got a business number, but I'll send all that in the details and that can get sent out in a little email or something like that.
Righto. And it's Lauren Sing EP, isn't it? The name of your business?
Yes, so it's Lauren Sing Exercise Physiology. My website should be laurensingexercisephysiology.com.au.
Lovely.
Website there. If you want to check it out, please do. There's
Yes, I'll be sending people right there to have a look. And is there any online tutorials? Do you have any online tutorials there?
I was going to start blogs, but I'm thinking an online tutorial might be better than a blog. So just like little videos, I'm thinking of doing those as well.
Yeah, just little things and little tips that, you know, you go, and support workers, you can email Lauren and go, oh, Lauren, I'm stuck with this. What can I do? And that might be a good way. And Lauren can do a little video and show more people and help more people how to do proper exercise, which would be fantastic. So that's gold, absolute gold. Love it.
And I've also got Instagram, which I'm going to get better at using, and LinkedIn as well. So I might put the videos on those ones as well.
Oh, that's good.
Yeah,
that'd be brilliant to spread it around.
Yeah.
Well, thank you again. Really appreciate your time, Lauren, and to everyone that's watching, really appreciate your valuable time. Hope you got a lot out of it. There's a lot of good tips there. Go back and re-watch and have a stop and replay parts that you really want to get to understand of what Lauren was talking about. So even things like the dynamic stretching or the hydrotherapy, those sort of things, go back and have a look, because that will help you and help your clients, which is what it's all about. So we'll say thank you to Lauren, and thank you to all of you guys for watching Community Builders Show. I wish you good health and look forward to seeing you on the next show. Take care from now.
Thanks, everyone. Have a great day.
Bye-bye.
Bye.